Mental health stigma is a powerful, invisible barrier that stops many people from seeking the help they need. It's rooted in societal attitudes, stereotypes, and misconceptions about mental illness. These negative perceptions make it difficult for individuals to acknowledge their struggles and reach out for support. But why does this stigma persist, and how does it impact mental health treatment? One of the most significant barriers to seeking help is the fear of judgment. Many people fear being labeled as weak or crazy. If they admit to struggling with mental health issues, this fear of being misunderstood or ostracized often leads to silence. People may suffer in silence for years, rather than ask for help because of how they perceive society's views on mental health. Society has long associated mental illness with weakness or personal failure. This belief can make people feel inadequate or ashamed. When experiencing mental health challenges, the perception that mental illness is a sign of personal failure can deter individuals from seeking help, as they may believe they should be able to handle their problems on their own. This harmful misconception contributes to the stigma surrounding mental health. Another reason mental health stigma persists is the misunderstanding of mental illness. Many people still believe that mental health issues are just in someone's head, or something that can be snapped out of. This lack of awareness about the biological, genetic, and environmental factors that contribute to mental health disorders creates misinformed judgments. When mental illness is viewed as something that can be easily overcome, people are less likely to seek professional help. Unfortunately, the stigma surrounding mental health is reinforced by the media. The portrayal of individuals with mental illnesses in films, TV shows, and news outlets is often inaccurate, and characters with mental illnesses are often depicted as violent, unpredictable, or dangerous, perpetuating harmful stigma. These portrayals contribute to the fear and misunderstanding people feel when it comes to mental health, making them hesitant to seek help. For those who do seek help, the stigma doesn't always end. People may face discrimination or feel invalidated when they do decide to talk to a professional. Therapists or counselors may unintentionally reinforce stigma by expressing disbelief or discomfort when discussing sensitive mental health topics. These negative experiences can discourage future help-seeking behavior and deepen feelings of isolation. The fear of judgment and discrimination is particularly pronounced in certain cultures. Cultural norms and traditions may discourage open conversations about mental health. In some cultures, mental illness is viewed as a taboo subject, often associated with shame or dishonor. In these communities, people are less likely to seek help because they fear bringing shame to their family or community. This fear of stigma can be especially detrimental to young people. Adolescents and teenagers are already in a vulnerable stage of development. The pressure to fit in with peers is high, and the fear of being labeled as weak or different can be overwhelming. The stigma around mental health can make young people feel as though they don't belong, preventing them from reaching out for help and support. Stigma also affects access to mental health care. People may be hesitant to seek professional help if they don't know how to navigate the healthcare system or are worried about the cost of treatment. Even when people are ready to seek help, they may not know where to turn. This lack of knowledge about available resources and fear of judgment can prevent individuals from accessing necessary care. Despite the significant barriers, there is hope for reducing the stigma surrounding mental health. Education and awareness play key roles in changing societal attitudes. The more we talk about mental health openly, the more normalized it becomes. When people share their experiences and seek help without shame, it encourages others to do the same. Efforts are being made to raise awareness and challenge the stigma. Public campaigns, advocacy organizations, and social media platforms are spreading the message that mental health is just as important as physical health. These efforts are helping to break down the barriers of stigma, making it easier for individuals to access the care and support they need. Mental health professionals are also working to create more inclusive and supportive environments. By educating themselves about cultural differences, they can provide better care and reduce the stigma that may exist within certain communities. Therapists and counselors are also advocating for change, ensuring that their practices are welcoming and free of judgment for those seeking help. In conclusion, the stigma surrounding mental health is deeply ingrained in our society, but it is not insurmountable. By challenging stereotypes, promoting open discussions, and providing accessible resources, we can help break down the barriers that prevent people from seeking help. The more we educate ourselves and others, the closer we get to a society where mental health struggles are viewed with compassion, understanding, and support. As we continue to break down the stigma surrounding mental health, it's crucial to recognize the power of language in perpetuating or diminishing this stigma. The words we use to describe mental health can either encourage or discourage individuals from seeking help. Terms like crazy, insane, or weak contribute to the harmful stereotypes that prevent people from reaching out for assistance. In recent years, there's been a growing movement to reframe the language surrounding mental health. Using neutral, non-judgmental language to describe mental health struggles helps shift the conversation towards empathy and understanding. This shift is essential for creating an environment where individuals feel comfortable seeking help and talking about their experiences without fear of judgment. Education is key in breaking the stigma. By teaching young people and adults alike about mental health, we can reduce misconceptions and help people recognize the signs of mental illness in themselves and others. Early intervention is critical, and the more educated we are about mental health, the more likely we are to identify when someone needs help and provide them with the support they need. The stigma surrounding mental health also affects workplaces and schools. In many environments, there is still a sense that mental health struggles are a personal failing rather than a medical condition. Employees or students may be reluctant to ask for accommodations or take time off for mental health reasons due to fear of being seen as less competent or less valuable. Organizations and institutions need to create supportive environments where mental health is prioritized and seeking help is seen as a strength. In fact, many companies are beginning to offer mental health benefits as part of their employee wellness programs. These programs aim to reduce the stigma around mental health by providing resources like counseling, therapy, and support groups. Workplace wellness programs that focus on mental health help create an environment where seeking help is normalized and encouraged. The role of social media in mental health stigma is also significant. While social media can perpetuate unrealistic standards of beauty and success, it can also be a powerful tool for reducing stigma. Social media platforms provide individuals with a space to share their stories and advocate for mental health awareness. Influencers, celebrities, and activists are using their platforms to dispel myths about mental illness and encourage others to seek help. The importance of community support cannot be overstated. Friends, family, and peer support groups play a crucial role in reducing stigma and offering emotional support. When someone opens up about their mental health struggles, a supportive response from those around them can be like feeling heard and validated is often the first step towards seeking professional help. Ultimately, reducing mental health stigma requires a shift in cultural attitudes. It's time to acknowledge that mental health struggles are part of the human experience. Just as we care for our physical health, we must learn to care for our mental health. This requires a cultural shift that prioritizes self-compassion and understanding, while challenging the harmful stereotypes that persist. Policymakers and advocates are working to implement changes in the legal system to improve mental health care. Increased funding for mental health services, better access to treatment, and the decriminalization of mental health issues are key steps in the process. As mental health becomes a priority for governments, individuals will have better access to the care they need without fear of judgment or discrimination. Social stigma and the fear of judgment often prevent people from seeking help for mental health issues. However, with continued efforts to educate, reduce stereotypes, and create supportive communities, we can make seeking help a normal, healthy, and courageous choice. The future of mental health care relies on our ability to challenge stigma and create a world where seeking help is seen as a positive step towards healing and growth. In conclusion, mental health stigma continues to be a barrier that prevents many individuals from seeking the help they need. However, as society continues to educate itself, shift attitudes, and create more supportive environments, the stigma surrounding mental health can be diminished. Through collective effort, we can build a world where mental health is understood, accepted, and prioritized, leading to healthier and happier lives for all.